Glucagon, common trade name for that is Glucagon. It is a pancreatic hormone and is also an insulin antagonist. It's all used to raise the blood sugar. That's our main purpose for it. Mechanism of action, it increases blood glucose by stimulating glycogenolysis. Dang it, I thought I had that word. Stimulating glycogenolysis in liver. I still didn't get the word. Oh well. But it increases blood sugar and causes the liver to release that. It also increases the heart rate, myocardial contractility, and conduction, similar to catecholamines. But it takes a higher dose to do that. You have to have 3 or 4 milligrams of glucagon to get those effects. Pregnancy class is B. Indications, our main indication with it is hypoglycemia without an IV. So we've tried to get a IV on this diabetic wake up, and then we can't do it, so that's kind of our backup go-to. If we can't give dextrose, we'll just give them some glucagon. Another indication that we can use it for is beta blocker and calcium channel blocker overdoses, where we have that depressed heart rate, and this can be given. Contraindications: hyperglycemia. Some adverse reactions to look out for: headache, dizziness, tachycardia, nausea, vomiting, and then rebound hypoglycemia. So if somebody has depleted glycogen stores in the liver, it can cause some real bad hypoglycemia. So it is important to eat a good meal after taking this and once they become aroused and alert. Just a drug interaction sort of to keep in mind is whenever you get glucagon, it comes as a powder and it must be reconstituted with the supplied solution before it is effective. You can't just mix it up with normal saline or D10 or whatever. Mix it up with the solution it comes in. Adult dosing for hypoglycemia is 1 milligram IM, so putting it in the muscle, because we're giving this only when we can't get an IV. For overdose, like beta or calcium channel blocker overdose, we're going to give 3 to 10 milligrams IV or IO over 5 minutes, followed by a 3 to 5 milligram per hour infusion if you need it. So the dose for that is a lot higher, and most services I would think that you'd work for are not going to carry more than 2 milligrams on the truck at a time. It's a very expensive drug, and so they're not usually keeping 4 or 5 milligrams on the truck at a time for those overdose situations. Maybe if you're in an area that is very prone to those overdoses, they do. So, but say most commonly you're probably not going to see high doses, but you might take it on transfers and stuff. Pediatrics, hypoglycemia 0.5 to 1 milligram IM again in the muscle. Overdose 0.05 to 0.15 milligram per kilogram via IV or IO over 5 minutes, and then you can set them up on an infusion of 0.05 to 0.1 milligrams per kilogram per hour if you need to. And again, at that higher dose for the overdose, you're trying to increase the heart rate and all that good stuff. Duration, if you give it IV, it starts working in about 1 minute, but if you have to give it IM in the muscle, then it takes 5 to 20 minutes, something like that, to start working. Peak effects usually within a half hour, and it lasts hour and a half in the system. So that usually once they become aroused, if you're giving it for hypoglycemia, they have plenty of time to eat a good meal, not like glucose where it's very short acting. And just keep in mind that if glycogen stores are depleted in the liver, then it's not going to be very effective. So if someone's severely malnourished, it might not be effective like we want it to be.